Okay, so hi everyone. My name's Hazel Marzetti. I work at the University of Edinburgh on a range of suicide and suicide prevention projects. But today I'm going to be talking to you mostly about an in-depth qualitative study that I completed in 2020 at the University of Glasgow, which focused on suicide amongst LGBTQ+ young people aged 16 to 24 in Scotland. Now, all the participant information that I'm going to share with you today is done so with my participants' permission, and I'll use pseudonyms throughout to protect young people's anonymity. But I would ask that if you could please not share screenshots or images of my slides outside of this session due to the sensitivity of the topic, that would be brilliant. So nothing on social media if that's okay with you. It's just because whilst I have permission to share the slides and the quotes and the images that I'm going to share with you, I think it can be quite confronting if a participant sees that on social media from a stranger where they're not expecting it. Okay, so before we get started, I think it's maybe useful to have a brief chat about the type of language that I'm going to use through this talk. So in the talk, I'm going to use the LGBTQ+ acronym. But as we can see on the slide, this can include a multitude of different identities. Probably the most recognisable is lesbian, gay, bisexual and trans. And in the acronym on the slide, we see the inclusion of Q for queer or questioning, I for intersex, and A for asexual or aromantic. And I personally am using the LGBTQ+ acronym to recognise the kind of diversity of the community, and to recognise that the labels that people use to describe their own sexual orientation or gender identity can be really dynamic, they can change over time. And in this specific study, we were keen to include anyone that felt that they belonged under that rainbow umbrella. Now, primarily, LGBTQ+ suicide gets spoken about in one of two ways. So either as a mental health problem in need of clinical support and intervention from which to recover, or it gets spoken about as an external social problem of victimisation, discrimination or stigmatisation, requiring what's sometimes termed anti-hate work to prevent. I hope that in this talk we can begin to explore quite how complex suicide amongst LGBTQ+ youths can be, and how much of this combines different elements of those young people's lives. So experiences of stigma, discrimination and victimisation, and elements of their mental health, and those broader experiences that we know contribute to suicidal distress more broadly amongst both the general population and also amongst young people specifically. So all of the 24 participants in this study had begun to think about suicide aged 14 or younger, but many described early experiences of suicidal thoughts using language that downplayed their significance. So describing them as not real or not serious or not legitimate, because at first they had not intended to act upon their suicidal thoughts. But all participants had experienced a worsening of this distress over time. And we can see an example from this from Ewan here on the slide. So Ewan describes first beginning to think about suicide age 12, where he kind of doesn't think it's very serious. But age 21, when I interview him, he describes kind of this worsening of distress over time and experiencing at that point a sense of what he termed do or die, in which he either felt he would be able to find a way to come out as a gay young man, and he wasn't out to anybody in his life. He was out to me and his brother, but nobody else. As being gay, and he wasn't out about being suicidal to anybody. So either he would find a way to come out and tell people that he was gay, or he would die by suicide. And so despite participants being quite keen to diminish the importance of early suicidal thoughts, they perhaps offer us a real opportunity for early intervention into distress that might otherwise escalate. The young people in this study spoke about how a broad community climate in which they lived acted as a subtle yet important contributor to suicidal distress. And this could include hate incidents from strangers on the street or within their familiar environments. It could include online transphobia, whether directly experienced or witnessed, and kind of those subtle, everyday comments, questions, and looks that we might call microaggressions that participants experience from those around them that established and re-established being heterosexual and cisgender as both normal and desirable. And to researchers and practitioners, it's really easy to see how these kinds of everyday comments might be considered too distant from the young person to have an impact on their suicidal distress. But as we can see here from the quote on the slide from Yasmin, it was exactly this that made it feel really hard for her to move through the world and brought a sense of hopelessness that was shared amongst other participants. And I think it's also important to think about the ways in which this lays the groundwork for some of those other experiences of homophobia, biphobia, and transphobia. So this is an exact example of this. So from the quote on the slide from Andrew, we can see the consequences of this sort of community climate, in which Andrew portrays homophobic bullying at school as a really normal, routine and expected part of his experiences as a non-binary gay young person. And this was really common across participants in the study. Of course, this could also be further compounded by other experiences such as ableism for disabled young people and classism. And whilst it's easy perhaps to see bullying as a kind of childish problem that is contained within the school gates, I think it's also important to consider the extent to which bullying actually can hold up a mirror and show us what broader social attitudes and social values are like. For some, therefore, suicide could be conceptualised as a way of escaping from a situation to which the participant felt there was no other available resolution. So Lily here acts as one example of a range of instances of what we've called queer entrapment that were found throughout our participants' narratives. So Lily described how her parents found themselves unable to accept her sexual orientation, in particular because of their religious beliefs. However, other participants reported that their parents had similarly found themselves unable to accept their child's LGBTQ+ identity without religious motivations. So this wasn't a specifically religious issue. Participants described parental non-acceptance of their LGBTQ+ identity as presented to them as unable to be changed, even if it later was. And whilst parents were presumably expressing a rejection of their child's LGBTQ+ identity in a manner that suggested it could be separated from their child as a whole person, for those participants, their gender identity and sexual orientation was such a fundamental part of their sense of self that rejection of it was understood as a rejection of them as a whole person, which some then responded to through suicide. Many participants, therefore, meeting other LGBTQ+ people, either through online or offline groups, was really helpful in their journey to feeling accepted and recovering from their experiences of suicidal distress. Whilst for many, this was because they took part in a group as an attendee or a participant, and those groups could be either professionally led or peer-led. For others, this sense of belonging and recovery was really fostered through themselves volunteering and taking a leadership role as they got older to help other young LGBTQ+ people to kind of go through those similar experiences. However, suicidal distress was not purely focused on their LGBTQ+ specific experiences and was contributed to by a range of other non-LGBTQ+ specific experiences. So, for example, adverse childhood experiences and the associated internalization of negative self-narratives that were associated with that. Here on the side, we see kind of Yasmin talking about that. And as I'm sure you'll be aware, adverse experiences in childhood, such as abuse and neglect, are well established as having a significant detrimental impact on young people's mental health and are associated with much higher prevalence of suicide and self-harm. Similarly unrelated to LGBTQ+ identity initially, young people in this study reported educational attainment problems contributing to their suicidal distress, with two describing how finding out about an assessment problem had acted as a catalyst for a suicide attempt. And I think it's really important to think more broadly about how these LGBTQ+ specific factors can interact with those that aren't immediately LGBTQ+ specific. So, for example, bullying often happened within the school environment. But for many young people whose parents had difficulties with their coming out and had been unable to accept their sexual orientation or gender identity, school could be a place in which there was a great need to achieve in order to do well and to move away to university, which for the majority of young people in this study was the only gateway that they envisaged to living independently away from home. And therefore schools were for many a really high-pressured environment. Some young people described how during such times of suicidal distress, they had used self-harm as a strategy to try and self-soothe and had found this effective. And which I think is really important to consider, as I think conventionally we've considered that self-harm preceding suicide is evidence of increased risk of a suicide attempt. But here young people were describing this as a method of de-escalating suicidal distress. Of course, there's no one-size-fits-all understanding of this, and indeed other young people in the study told stories that resonated more with our conventional understandings of the relationship between suicide and self-harm. So, for example, articulating a sense that they were unclear both before, during and after a crisis where self-harm had stopped and a suicide attempt had started. So really articulating a blurring between suicide and self-harm. And I think it's really important to consider this full spectrum of experiences, because I think it highlights how individual these physical manifestations of emotional distress can be, with for some, this being kind of a signal of an escalation in that young person's danger to themselves, whilst for others, self-harm can be seen as the polar opposite, as a way of settling themselves during crisis. And really, without getting to know that young person and having time and space to listen to them, it's really difficult to know where on that spectrum they are. And it's also worth noting that of the young people who reported self-harm as an effective strategy for managing suicidal distress, although some were really comfortable with this, others were keen to find methods of self-soothing that were, in their words, healthier, highlighting the importance of working with young people to find those coping strategies that both work for them, and also to consider what type of coping strategies that they would like to work for them. Although research has suggested that young people, and particularly LGBTQ+ young people, might prefer to seek out help from those in their close networks, such as friends and family, young people in this study often reported extensive professional help-seeking behaviours. Some of them had, however, come up against a number of barriers. So trans participants in particular reported challenges balancing mental health care with gender-affirming care. And although we can see how this sort of toing and froing described by Alex on the slide happens, because each of those services wants that young person to get the best specialised care that they can, this can be a really, really difficult experience for the young person in the centre of it, who is just trying to access support. And this feeling of being moved between services without actually accessing support can therefore be extremely distressing. Not only this, but for all LGBTQ+ young people in the study, perhaps understandably due to experiences they were having at school, online, in their family homes and in broader society, there were some concerns expressed about whether support services would be supportive of them as LGBTQ+ people, or whether homophobia, biphobia and transphobia would also be present within these services. And in particular, there were concerns raised about the conflation between being LGBTQ+ and being mentally unwell, with one young person expressing concerns that they didn't want to contribute to stereotypes and possible discriminatory attitudes by being a bisexual young person who was experiencing mental illness. Some real broad worries there. The individual relationship between a young person and a practitioner could, for some young people in this study, be the only adult affirming relationship, both in terms of their suicidal distress, but also in terms of their LGBTQ+ identity that they had in their life. So where this went well, it could have a potentially powerfully positive impact on the young person's mental health, particularly as that young person was often waiting quite a long time to get support, and therefore could have an extremely heightened sense of expectations kind of built up over that course of time about what that kind of therapeutic support might offer. So by the time they got to see someone, there were some quite high expectations. To end our interviews with the young people, we asked them what they believed would help reduce LGBTQ+ youth suicide in Scotland in the future. At the most blue skies level, LGBTQ+ young people wanted anti-LGBTQ+ stigma in society to be challenged. But perhaps as a more short-term goal, they strongly advocated for increased and improved mental health services. They were really realistic in recognising that the resourcing had to come before this was possible, and they knew that there needed to be government investment within this. But they wanted services that were firstly able to provide immediately accessible support during times of crisis. And they also wanted all mental health services, crisis and otherwise, to be aware of and sensitive to the needs of LGBTQ+ people. But where this wasn't possible, they wanted those services to be able to recognise their own limitations and refer outwards towards services that were sufficiently equipped, articulating the importance of connecting with other LGBTQ+ young people and people more generally within LGBTQ+ groups and spaces to counteract those kinds of experiences of bullying, isolation and rejection that they were experiencing elsewhere, and thus cultivating a community that could help to support them through difficult times that could otherwise escalate. Now, I know that's a super whistle-stop tour, but if you're interested, we have an overview of the project findings as well as all the publications arising from it on my website, which you're welcome to look through. And if you'd like more information or have questions, I know there's a Q&A afterwards, but sometimes it can be tricky to ask questions in front of everyone. So please feel free to get in touch via Twitter or by email. A couple of other just small things before I finish up. Building on the work that I've talked about today, I'm working with a practitioner colleague, Dr. Kat Turney, to establish a small network of researchers and practitioners working in the area of LGBTQ plus youth mental health to facilitate a space for cross-sectoral thinking and working. So we had our first meeting back in October, which was brilliant. And from there, we decided to keep in touch via quarterly online brunches. So the first of those will be happening on January the 19th. So if you're interested, it's going to be very informal, just kind of a sharing space. But if you'd like to attend, please do get in touch. And the second thing is, I'm also working on a project at the moment that Leah mentioned called the Suicide in As Politics project. And in that, we are using creative workshops to work with LGBTQ plus adults, as well as other minoritized groups to explore their views on current suicide prevention practices and policies. Now, that work is ongoing currently. So whilst we have these couple of really fabulous artworks to share, so on the left, you can see a piece called The Rigidity of Noise, which is by Kiva, responding to representations of gender within suicide prevention. And on the right, we have an image from Will in response to LGBTQ plus suicide prevention. But we'll be analysing that data. We're collecting a bit more data and analysing that data over the next year. So if you're interested in the research that we're doing on that, watch this space. And finally, I'm currently working on a project which we're trying to establish, looking at experiences of LGBTQ plus suicidal distress and related service use throughout the life course. So children and young people, adults and older adults. We're waiting to hear back about the funding of that, but if we are funded, that'll be starting up probably the end of next year. So if you're interested in getting involved, shaping that project, finding out more about it, please get in touch. And that's me. Thank you.